Good morning. I'm Steve Rosansky, President and CEO of the Newport Beach Chamber of Commerce, and I want to welcome you to our monthly Government Affairs Committee meeting. We've got a great program for you this morning, and I've got Alberto with me. He's our new head of our Government Affairs, our Civic Affairs Committee here at the Newport Beach Chamber of Commerce. Lots of things going on here at the Chamber right now. We're as of June 15th, I've dubbed that Liberation Day, where everybody can now, get together and, we can put the masks aside if we've been vaccinated, no physical distancing, no occupancy limits, things like that have all evaporated for the most part. Some businesses, I think, are still enforcing that. My wife said she went to, I think, Costco yesterday, and they were still enforcing mask wearing there. So that's kind of interesting. So we'll see how all that plays out. But putting that aside, we've got, like I said, a great program, with our UCI partners. And so I will turn it over to Alberto. But before I do, just want to remind you that after Chad's done with his talk, he'll stick around for some questions. So if you do have any questions during his presentation, please type them in the Q&A box, not the chat box, the Q&A box, and we'll try and get to all of them if we can. So, and then after Chad's done, we'll have some updates from our legislative offices that cover the Newport Beach area. So, Alberto, I see you're standing out in front of UCI, as you usually are, otherwise known as your driveway and your RV.
Good morning, everyone. Thanks for joining us this morning. Thanks, Steve, for putting this together, and Chad, thanks for joining us. We're going to hear some wonderful things coming down the pike here. But let me introduce our CEO of UCI Health. And let me just say that he assumed all these responsibilities right at the beginning of the COVID-19 pandemic. Chad oversees the Orange County's only academic medical center. He's our Chief Executive Officer for UCI Health. He directs all clinical and patient-serving operations, including UCI Medical Center in Orange and ambulatory sites across the county. Chad joined UCI Health in December 2018 as the Chief Operating Officer. As COO, Chad oversaw the daily business operations of the UCI Medical Center, which includes the hospital and several specialty units, including the other UCI-operated healthcare centers throughout Orange County. His responsibilities include the administrative functions, including general and ancillary support services, facilities management, design and construction. You'll hear about that. Information technology and special projects. I understand he is also a great barbecuer, so hopefully we'll learn about that at some other time. But thank you, Chad, for taking the time out of your busy schedule to share some wonderful news about UCI Health.
Thanks, Alberto. I really appreciate that. And it is a real pleasure and privilege to be here this morning. It sounds like you must have talked to my mother to get that description about me. So thanks. I'll have to send her a card. It's a real pleasure to be with you all and to serve in this role as CEO of UCI Health. As Alberto mentioned, I'm the one crazy enough to say yes to the opportunity. On April 1st is when I started officially as CEO after being here as the Chief Operating Officer for about a year and a half before that. And I'm pretty sure that I was the only candidate that must have not gotten COVID and could go through the interviews. And so therefore they were stuck with choosing me. Because who takes over the helm of a health system during the middle of a global pandemic? So I think timing is everything, and I actually feel very fortunate to be able to step in and help what an amazing team we have here. So let me share my screen. We'll run through a few slides really about what's happening around UCI, and then get into our new plans for the new medical center that you may have heard a little bit about as well. So Alberto, make sure you can see that. You'll give me an okay.
We're doing good.
Okay.
I see it.
All right, excellent. Well, if that stops for some reason, you let me know. Okay, so a little bit about UCI Health. You may not know, some of you may know this, and I won't read everything on the slide, but we're proud of a long list of onlys. Here's just a couple, and I just pick out a few. I think one of the things that I think about a lot is the only level 1 trauma center. And when we think about some of the most amazing things that happen to our community, the level 1 trauma center is there for our community. When I think about the shooting that occurred here in Orange, or where I stand here at the medical center, not that long ago, actually, just 2 months ago, the level 1 trauma center is there. And so that's what a level 1 trauma center does, fortunately and unfortunately, because that's the need within our community. Home to Orange County's only National Cancer Institute's designated comprehensive cancer center. We're very proud of that, and we'll continue to expand that, and we'll talk about that in just a minute. You talk about revenue size within your organizations, I'm sure. So we're 1.4 billion in revenue, a net revenue here within the health system. That'll grow to about 1.6 billion here in the new fiscal year that starts in just about less than 2 weeks. We have 8,000 total FTEs. The city I grew up in North Carolina, had 8,000 people in it. So I literally refer to this as a small city. So you can imagine what all comes with that. The other way to look at health systems is to think about licensed beds as a scale and size measure. When I came here, as Alberto mentioned, we were around 400 beds. We added a new unit of another 18 beds. And we're currently under renovation to add another 41 beds here in Orange that will open here very, very soon. And what we'll talk about in a minute is we are always full here in Orange. So those additional beds here and for the new site down in Irvine is really, really important to be able to continue to expand. We've been recognized recently by the Age-Friendly Health System, again, third party, because of our focus in geriatrics, as well as since it is Pride Month, I love to highlight every month, but absolutely during Pride Month, that we are a leader in healthcare equity from the Human Rights Campaign. I'm very proud of that. A lot of work has gone into that, and we have more to do. So this is my team. I am so fortunate to be able to work with a team of experts. And you may know some of these. Some folks have been around the area for a while. Others are a little bit new. I believe Randolph Sivabesti is our Chief Financial Officer. He came to us from USC and Keck Medicine just recently. And prior to that was at UC San Diego Health. And Brooke Baldwin joined us, I believe about 4 months ago now, as our Chief Nursing Executive. Used to work here at UCI Health, left and ironically also went to USC. And then came back to UCI Health about 6 years later. So we're really pleased to have her back. But I am surrounded by an excellent team, and it's my pleasure to be able to work with all of them. You also may not know, when we think about UCI Health, historically, and for many, many years, we've been solely focused here in Orange. And again, that's right here out my window. I can see the 5 freeway and our main bed tower. So really over the last 4 years really, I think about the COVID time warp, we've been spreading our wings across the county, going to where the people are, expanding our network, and trying to make it easier for you and your loved ones to access the amazing clinicians and services that we have at UCI Health. No longer do you just have to come to the Academic Medical Center flagship here in Orange to do that. So you can see in the top right, those little plus signs are sites that we've opened just over the last few years. And the location of the new hospital. And as we start to look even further south beyond that, we plan to open roughly 2 sites per year, our fiscal year. We're thinking about 3 next year, depending on timing. We're getting ready to open our latest site in Laguna Hills, actually in, well, the end of the month. I think the first patient is scheduled for around the 28th. So that's the plus mark you see there. In the top right-hand side of the screen. So we continue to go to where we can make it easier for the patients so they don't have to fight the 5 freeway for everything that they may need to get to us. So everything we do is covered under our incredibly simple and powerful mission called Discover, Teach, and Heal. Everything we do falls under that. And then the 3 pillars down below are really sort of the filters or the lens that we look through when we think about our strategic initiatives and the work that we're doing. So we are, and we absolutely live it every day, improving the health of our community. We'll talk about what we did through COVID-19 in just a minute around that. We're working with payers and others to increase value so that caregivers, providers, everyone's involved in the value equation, whether that's inpatient, outpatient, or maybe even potentially at home. So we're trying to turn the cost curve and change it so that we can be a different value player in this marketplace. And then we will transform ourselves, of course, because we're attached to the power, I like to say, of UCI, the broader UCI. We get to transform ourselves by connecting to the amazing researchers and others that are things that are happening at the main campus. So that's our opportunity. So briefly on COVID, wow, what a few months it has been. When I think about, when I go back to our infectious disease experts here within the health system and at the main campus, we're already hearing about and starting to study and learn about this thing that was happening over in Asia that we didn't even know what it was yet. We didn't know what to call it. Yet our colleagues, because this is all they do, and this is the power of the academic medical center, right? They are so plugged in and go so deep from an infectious disease standpoint, from this standpoint. They were already hearing about it. We started planning for a surge, is what we like to call it, before the end of 2019. So I remember calling our first meeting to activate our incident command structure, which is something that's born out of the military that we've stolen and pulled into healthcare to help us respond to major events. And we practice this a lot. We actually practice and simulate a major event, for example, that would result in a surge, let's say at the Honda Center because it's so close by, or the baseball stadium because it's so close by. And we run and simulate this regularly, several times per year. So we felt like we had really good processes in place. We had a strong incident command structure, but we weren't sure what was happening and no one knew what the surge would be or how long the surge would last. That's the difference. When you have, if you were to have a horrendous event, let's say at a large scale facility like the Honda Center, we know that that's a rapid event, that a surge of patients would come to facilities and then it would stop and it would go away perhaps in a day or 3 or whatever the timing may be, not for 14 and 15 months. So it really tested our infrastructure and that incident command structure because it wasn't initially set up to run as we have for over a year. We quickly convened our colleagues across the OCs and leveraged our experts in infectious disease to help start to spread the gospel, the truth, and the science and the fact around really all that we knew. And it was changing by the hour and certainly by the day in the early days. We, again, leveraged our partnership with the main campus, and I cannot thank my colleagues at the main campus enough. Quickly, they turned to manufacturing face shields when you couldn't get a face shield like you see here on the screen. We absolutely leveraged clinical trials. We absolutely talked about all the other things that we could do within our bioengineering and medical engineering teams, everything that was happening. And we even had our school of medicine residents do donation drives to pull PPE out of labs on campus so that we could redeploy them here. I mean, it was everything you can imagine. And to me, that's the power of the broader UCI as it relates to that moment in time. So really powerful. So what does it mean to us here? So as this was happening, you may recall, right? We all had to shut down. I remember that moment distinctly. That was in mid-March. We went from basically a few virtual visits or telehealth visits for our patients on the outpatient setting, maybe about 100 a month or so, very, very few, to over 15,000 a month. And we did that in less than 2 weeks' time because we had to, and we were already doing a lot of this work. But it also took some time for our patients to feel comfortable with that. So we actually had a lot of education going out to our patients to make them feel comfortable that the virtual visit is still very important. And today it's still a little less than 30% of our ambulatory visits. I don't think that's going to go away, to be quite honest. I don't know when the last time is that you physically went into a bank. We don't even call it telebanking. You just bank online. So I think we're going to say virtual visits and virtual care is just going to be another tool in our tool belt to provide the best care possible. We absolutely started what's called At Home with UCI Health, whereby we discharged patients earlier from the hospital and monitored them at home with technology and our expert clinicians, monitoring them from afar. And at one time, we had over 40 patients being monitored at one time. Our average nursing unit here is 30 patients. So that freed up an entire nursing unit during the surge when, you know, the headlines, there were no beds available, there were no ICU beds available. That move alone, I think, saved us tremendously and allowed us to continue to accept the most critical patients into our hospital from all over. We also deployed a mobile field hospital. You might have seen or heard about this. In less than 2 weeks' time, I wish you could see it. We erected this field hospital right here down in front of our offices here in between the hospital and have served over 200 patients in that field hospital. Not ideal place to do it, but during a surge situation, it became extremely important as another location for us to provide really amazing care. We certainly ramped up our drive-up testing in 3 locations around the community. And then COVID testing, holy cow, did we realized something early in the days of COVID testing. We had patients coming in, as I mentioned, we had a lot of COVID patients coming in here. It was taking about 5 days to get the COVID test back from third-party lab providers. Our average length of stay for those COVID patients was somewhere around 5 to 6 days at that moment. So essentially, for many of those patients, we had already discharged them before we got the COVID test result back. I'm sorry, but that is not good enough. So we quickly pivoted, invested heavily in the testing technology, and now, and since then, we've been able to turn tests around in really several hours. You see 4 to 6 hours here. We have a rapid test that will do it in 1 hour. Totally changed the way in which we cared for the COVID patient, inpatients as they were here. And I'll show you some of the results of that in just a minute. So on the right-hand side, we saw over 2,200, now that number is a little out of date, 2,200 total inpatient cases. Well, what does that mean? Our surge at the highest amount, we had over 200 COVID positive inpatients in beds. And as I mentioned, we have about 418 total beds. So half of our hospital was full of COVID positive inpatients, very, very ill and complex patients. 51% of those is the first time they've ever come to UCI Health as an inpatient. That's an interesting marker. And about 90% of those came through our emergency department, which is basically what you would expect when I talk to colleagues in other countries. But as I mentioned, because of some of the things that we did very early on, because of our infectious disease experts and our amazing clinicians, and our ability to deploy testing rapidly and quickly, look at the results from UCI Health. And I am so proud of this, that across 100 academic medical centers in the country, down in the bottom there, you see it's the National Academic Medical Center Benchmark and Database. UCI Health ranked first in mortality. That means our COVID patients had the lowest mortality rating by coming through UCI Health. And we were 7th in length of stay, which means we got them out quicker, back to that using and leveraging our ability to monitor you at home and many other technologies. We were 7th out of 100 for length of stay. So there's a fine balance there of getting the patient out quickly and safely and still having an amazing outcome as well. And then in California at the top of the page, I'm so pleased to say that we ranked first in those 2 measures across all the academic medical centers, which we're in wonderful company, by the way. So really, really proud of this team and all they have done to have those results. It's really outstanding during an amazing year. So what have we been doing to continue to leverage our expertise? You see in the top right-hand side there, that's Dr. Susan Huang giving a talk at one of the nursing homes. We quickly partnered with Orange County and got into the nursing homes. As you remember, that was a real hotbed and that we needed to get education and awareness campaigns going. So we sent our excellent colleagues, Dr. Huang and Dr. Gohill and others, in to do training for nursing home operators to change the way in which they were preparing for this virus in the early days of this. And we continue to do that today, by the way. We've always had a focus on health disparities at UCI Health. It's within our core DNA. And we continue to leverage our FQHCs, our federally qualified health centers, and also partner with others around the community, including the governor's office, to continue to get vaccines out to those most underserved as well. We've gotten a lot of requests for help me get back to business. And so our infectious disease experts have partnered with many OC businesses to mitigate risk, to think about what are the best practices from cleaning to reopening, you name it. There's a few logos there that you'll recognize, but so many more partners have come to us to leverage our infectious disease expertise, and we're so proud to partner with them. And I mentioned the consortium. We are so pleased to work with our colleagues that are all in the healthcare space to really continue to message the importance of really the facts, the science, and getting back to taking care of your health as well. So hopefully you've seen some of that messaging come across. I mentioned vaccines. We're actually now at 126,000 total doses of vaccines that have been administered. Huge number when I think about that. Wasn't that long ago in January and December when we just started that. I also mentioned partnerships locally. So we went from really large events where we could do 5,000 a day at the Brin Center at the main campus at UCI. Again, another wonderful way in which we get to partner with our colleagues at the main campus. And then we've zoomed down into much smaller events, more targeted events. As you can see some examples of those here on the screen in partnership with the local school districts, as well as through the governor's office, targeting pockets in Santa Ana, Anaheim, and we've got a couple more scheduled coming up. So really, really proud of the lift. You can see some of the teammates there in their UCI Health Blues talking to the pastor of the Second Baptist Church in Santa Ana. We administered over 319 doses that day to otherwise patients who may not have had the opportunity to get it. So I'll stop there and we'll pivot. Let's talk about this amazing new project that's happening right on the edge of Jamboree Road. This is the latest rendering. You can see the main campus of UCI off in the distance and the bit of the marshland in between. This is a really exciting set of projects and I look forward to just walking you through that. Here's that location again. You all probably know this better than I. I'm still learning everything around here, but Jamboree Road, very busy, heavily traveled road in the intersection of Campus Drive. Today, I feel like, Alberto, I feel like Campus Drive is a bit of a backdoor entrance into campus. Well, we're going to change that dramatically with this project and other projects that are happening on the corner here of campus and Jamboree. You can see on the right-hand side of the screen, we're starting to lay out the site now. It does have several different components, and so I'll walk you through that. The first building facing at the top of the screen, right on Jamboree Road, is known as the Center for Advanced Care. It will go into construction first and open first and be targeted to all outpatients. Then we have the ambulatory care and very large cancer center in the bottom right of the screen. That will follow the Center for Advanced Care, and then ultimately the hospital. And I'll walk you through those details. So I get asked a lot, why are we doing this? Well, we're doing this really, I already mentioned, we are full here in Orange. We have expanded capacity. I mentioned we've added beds, we've created technologies and worked with partners, technology partners to extend healthcare into your home, but we are still full. Right now, we are still full in Orange. So we have an access issue and we have a growing community that you all well know about. So we have to expand to meet that growth need. So we also think about proximity to the main campus. The chancellor tells me that maybe more than 50 years ago, there was talk about a hospital at the main campus of UCI when the main campus was being designed and thought about. And for many reasons, some of which I know about, we landed up here in Orange. So this gives us a real opportunity to integrate our physicians, clinicians, and researchers together and being physically proximate, which is just the power of that cannot be underscored enough. We already talked about growth. And again, our ability to expand as Irvine, as Newport, as Point South are some of the fastest growing areas in Orange County. Certainly the medical need continues to expand with that. All right, so here's the detail on the buildings. The Center for Advanced Care on the left, you can see it's about 165,000 square feet. We're still massaging these images. So if you take a picture of these, they're already out of date. That's the design phase that we're in right now. They're all in the final throes of design. We are building in some shelled floor for growth. Healthcare construction is very expensive. And so we don't want to have to come back and do that. So we've got some shell space built in, which is nice. You can see the key outpatient services that will be in this building. Again, facing Jamboree Road. We'll have the Center for Children's Health, adult primary and multi-specialty care, and after-hours urgent care. Our Neurosciences Institute, orthopedics, and spine would be there, as well as our Digestive Health Institute. And then you hop over to the other side. Again, we talked about beds earlier. We're 418 beds here today. We're adding 40 beds here soon. And then we're adding 144 beds in the new tower that will be built here at this new project. It will have a full-blown emergency department as well. And 8 operating rooms on the inpatient side, another 10 operating rooms on the outpatient side where they come together. These two buildings, including the cancer center and the hospital, represent almost 600,000 square feet of space. And you can see the major service lines that will be there. Again, including some shelled space for growth, which again is super important when we think about the growth needs of the community. One of the things we've learned through the pandemic is we need to continue to maximize the amazing Southern California weather so that we're not cooping up patients and families into small, tiny, historically small, tight hospital waiting rooms. So we're creating really fantastic spaces between the buildings, around the buildings, to get out of the buildings so that you can wait safely and enjoy the outside. So you don't feel like you're stuck in a very institutional sort of medical center complex. This is just one example of how we're designing an amazing sort of events and plaza space between the two buildings with really fantastic views. Again, here's another example of a new waiting room, for example, that's not tucked under the building or some space with no windows and low ceilings. In fact, there's a small waiting area just inside there on the right. It's all glass. And then you have a really nice large outdoor patio that you can step out, still be close to where your loved one may be receiving their care, we'll text you and tell you to come right in when we need you so you don't have to stay inside the whole time. We're creating an amazing cafe. You may not know this, but we have 4 Culinary Institute of America trained chefs in the hospital. That's crazy to think about, I know, but gone are the days of hospital food. We're changing that too, by the way. And we have an amazing cafe with probably one of the best views in town, overlooking the marsh and overlooking towards the main campus, that will provide very healthy food. And I expect we'll have a lot of folks just coming to sit here, work, have a cup of coffee, have lunch, and go about their day. They may not even be coming here as a patient at that moment. And that's okay too. We want to encourage the healthy lifestyle through healthy eating as well. Here's another shot of how the campus may look at night. We're starting to now look at it different times of day to see how the light works around the campus, making sure that we're setting ourselves up for success from a design perspective. And finally, I'll end with sort of the timing. So again, facing Jamboree Road, the Center for Advanced Care will happen in early 23. The Comprehensive Cancer Center in the back left there will happen a few months after in 23. And then the hospital and emergency department just takes longer to design, build, license, and regulate, and then open for the inpatient component. So that has and will always be the last building to open. But we'll start seeing patients on this site in 2023, and you'll start seeing what I like to call a good construction mess on this site just this summer. So they will mobilize here in the next few months to start grading and clearing for this first building. So when you're driving up and down Jamboree Road and you see what's construction fencing going up, now you know exactly what's happening there. So tremendous investment, about $1.2 billion of total investment to create what you see here. We expect to create about 2,500 permanent healthcare jobs and another roughly 3,000 temporary construction and trades jobs by going through these projects. So a huge lift, in my opinion, for this region and for this community. And we're so pleased and proud that we have the full support of our UC Board of Regents to go full steam ahead. So with that, Alberto, I'll stop there.
Well, that's quite an ambitious program you've got there for the next 4 years. I know what you'll be doing. I hope you'll agree to invite us to help with the ribbon cutting ceremony on that new facility in 2023, even though it's technically not in Newport Beach. We call that Newport Beach adjacent right there.
I like that.
Maybe we'll even try and annex it in. You know, we'd love to have that new facility have a Newport Beach address, but looks like my colleague over at the Irvine Chamber is going to have that distinction. But in any event, let's see. Well, I don't see any. I don't see any questions in the Q&A yet. But please, if you're on the call here, you do have a question, type it in there. We'd love to have Chad answer it. But while we're waiting, there's 2 popped in there right there. So, all right. Well, here we go. We got this guy's like gum on my shoe. I just can't get rid of him. Rush Hill, my former colleague with the Government Affairs Committee, has a question. He wants to know, where is the funding coming from for the $1.4 billion expense? So I saw on your slide, it said something about bond money, sounded like for children's hospitals. And I remember that the chamber actually supported that proposition a year or 2 ago, I think it was now.
Yeah, thanks. That was probably 2 years ago. That was the Prop 3 funding opportunity. So great memory there. Yeah, so we do have some funding coming through that for the Center for Advanced Care. So excellent question. But essentially, I ended with that we have the full support of the UC Board of Regents, right? That's their support for our strategic plan to build this with our own money, right? It doesn't come with any funding per se. And so we are going to the bond market, the broader bond market, to leverage our amazing credit. And we will take cash out of our reserves to invest as well. And we have a target to raise a minimum of $100 million in philanthropy. And we're well on our way to that. Some recent announcements that just came out about that as well. And we see that as a true minimum threshold of 100 million and have a real opportunity, I think, to go way higher than that. So that's the combination of how we will fund it.
You know, I just was reading that Jeff Bezos and his wife are donating like $3 billion to like 286 charities. Maybe you can make it 287 and, get 10 or 15, 20 million from them.
Good idea.
I'm sure you get a lot of Amazon deliveries.
Chad, we've got another question here. Of the patients who were COVID positive that you mentioned, how many were admitted specifically for just COVID?
Of the patients that were COVID positive, so we'll make sure I understand that question. So when I talked about over 2,200 COVID positive inpatients, those patients were admitted, those 2,200 were admitted for COVID and the complications related to COVID. I hope that answers the question.
Yes.
Certainly we tested a lot more folks on the outpatient setting. We were the early days, we were the testing hub for many other providers once we pivoted and invested in our own testing. And we tested thousands and thousands of outpatients that thankfully did not warrant inpatient care.
Okay, our next question is from Dorothy Larson. She says, it looks like the new facility is where the Arboretum used to be. Is there still one, or do you know? I don't remember an Arboretum being there, but it's possible.
No, that's an excellent point, Dorothy. It's kind of on the back side, closer to the campus drive side, of if that's the way I like to think about it. And there's also a comment about the hydrogen fuel cell station. And so most of that will be relocated. The Arboretum, we're in discussions right now about, can it expand in its current location and kind of morph in size at the back of the site, which I think would be an amazing asset and resource for, let's say, a family of a loved one that might want to go take a stroll and walk and get out of the hospital environment. So we're working on the design of that now, whether the Arboretum stays and expands or kind of moves on the site. There is additional development that the broader campus is planning with us adjacent to the hospital and the buildings we just shared. So the Arboretum will come into play then as well. So stay tuned on that, but it's a wonderful opportunity. And if you haven't been to the Arboretum, it's really nice.
So Pierce Swan asks a good question here. He's a longtime member of the Irvine Ranch Water District. Looking forward to the new facilities, but what happened to the school currently on the site? I think he's addressing the child care facility that was there, that closed, I think, a couple years ago. But also heard the main campus was thinking of moving the planned art museum onto your site. Not sure how that could work with parking and all other conflicts.
Great question. The school predates me, but I believe, Alberto, I've been told that the child daycare center, or I'm sorry, the terminology escapes me, has been shuttered or for some time. So that has moved on. And so we will bring some of those functions back through the Center for Advanced Care from a healthcare needs perspective, but that is gone. I don't know about the museum thinking, maybe you do, Alberto, but again, there's about 35 acres there. If you think back to that site plan I showed, the health component of that is taking up about, I think it's about 15 acres. And then the other balance will be preserved for other campus-based development as we work together. So I'm not sure of all the buildings that are being planned for that yet, because it's still very early. But Alberto, I'm not sure if you're aware of others.
Yeah, and if everyone can think that the hospital will be much closer to the Birch Jamboree intersection rather than the campus Jamboree intersection.
Great point. Yeah, Birch will drive that into our new driveway, if you will, into the medical center campus. Good point.
So,
all right, go ahead.
We have another question here from Denny Murphy, one of our chamber members. It's a two-part question here. Would you attribute the dramatic drop in COVID cases and hospitalizations to the vaccine rollout? And also, hospitals were suffering financially during the pandemic. Has that improved over the past several months? And I'll just add to that, because I sort of had that kind of a question written down here too. How do you, as an institution, handle, obviously the huge surge in patients? A lot of them needed intensive care, very expensive care. How are you reimbursed by the government for that? Private insurance? How is that money from the state? Through your funding through the state, or are you going to raise prices going forward? How do you handle that?
Excellent point. So let me just take the dramatic drop in COVID cases question from Danny first. Absolutely, unequivocally, the speed at which we were able to get vaccines out in Orange County. Again, we had a huge role in that, over 100,000 doses, but so did many of our other colleagues in the healthcare agency and others. So we were pleased to partner in that effort. That absolutely impacted the drop in COVID the drop in patients requiring admission. I like to say that the inpatient numbers for COVID positive is a bit of a lagging indicator about what's happening out in the community, right? Because there can be lots of COVID happening, but only the sickest hopefully have to then come to the hospital as an inpatient. So absolutely, Danny, there. So financially, hospitals and health systems, all of us took a pretty tremendous hit, just like many of your businesses took a tremendous hit. And maybe for us, I like to say it was like the perfect storm in a really bad way, that our expenses went through the roof. You can imagine what we were spending to buy PPE and supplies when the demand was through the roof. Guess what? Pricing didn't come down. Guess which way it went, right? It went way up. Not to mention it was hard to even manufacture and get it. So pricing went way up again because of that. And so that, coupled with it's hard to get staff when you're surging like we were all surging. And we have very low turnover rate of staff here, and we were redeploying staff to fill needs. And we needed to go to third-party agencies in the urgent time during the biggest surges to supplement our staffing. And you wouldn't believe what we were paying per hour to get folks to come to Southern California, to beautiful Southern California, because they had so many options to go work and travel elsewhere through these agencies. Because if you recall, we were surging kind of around the same time, but the peaks were happening at different times around the country. And these traveling nurses and technicians kind of follow that wave. And yes, the demand far outstripped the supply, so the pricing went way up. So we were no different. We were hammered from a cost perspective, and revenues were way down when we had to shut down all of our outpatient environment as well. So we pivoted quickly to redeploy and be as lean as possible and effective as possible. And I feel really good about where we are coming out of this, but that's bolstered by we were in a very positive financial state going into this. So I wouldn't want to be playing anyone else's hand coming out of it. So you mentioned also about other funding sources. Many of us participated thanks to the federal government's CARES Act relief. We were able to receive some of those funds, absolutely helped offset the losses that we incurred, but it was about 40 cents on the dollar, unfortunately, but we'll take it. I'm not going to complain. I look forward to thanking those representatives that helped us do that, because it was a huge lift when it came in, but it didn't fill the bucket the whole way for us or for probably many, many other providers. And then finally, we got no additional funding through the state. We, as a healthcare system under UCI, that's probably the biggest confusing point for my colleagues that I speak with around the community, is we receive no state funding at UCI Health as the health system enterprise. Absolutely, our colleagues on campus and the researchers and everything that's happening there is funded through the state pathway, but the health enterprise is not.
I want to follow up on something you just mentioned about the PPE and the expenses there. So, and related more to business now, I think today Cal OSHA is supposed to, their board's going to meet and come out with new regulations as far as what employers are supposed to be doing with regard to their employees. And it looks like they're going to change their mask requirement anyway for vaccinated individuals, but probably still keep it for unvaccinated, as the state has basically still also said, even though, you know, Tuesday was Liberation Day, that was only for vaccinated people. Technically, unvaccinated people are still supposed to wear masks. But in the workplace, Cal OSHA was requiring that employers offer N95 masks to their employees. And so are you still finding problems sourcing that kind of stuff? I mean, do you anticipate that if Cal OSHA does pass this requirement, that it will make it more difficult for you to, because that was one of the arguments I know, like Cal Chamber and the Restaurant Association were making, like, hey, you're going to require all these employers to provide free masks to their employees, and it's going to take away from where they really need to be in the medical realm. So how do you, any comment on that? Or?
You know, the supply chain process is extremely fragile. We learned this early on. It has gotten much better as it relates to masking and gloves and other things for healthcare, right? I like to say that we've gone pretty deep with our supply chain partners and leveraged that. And our supply chain team, I didn't spend the 3 slides on all of our supply chain team has done to stockpile early on when we started to hear about this, as I mentioned, before it was even known thing. So we were very fortunate and very proactive. So I feel good about what our supply lines look like, but it's an excellent point, and there will be more demand on an already fragile ecosystem around supply. So I think it's something we need to all watch very closely.
Okay.
Chad, if you will, maybe share some thoughts on, what inspires me on a regular basis, the incredible folks on campus doing research, and then your team doing clinical trials at the hospital. And then as a follow-up, maybe you can talk about the partnership between UCI Health and CHOC.
Oh, yeah, thanks, Alberto. I failed to mention that earlier. So from a research and clinical trials perspective, really the COVID experience is a wonderful example of that. We were able to achieve the results that I mentioned, the top in California across all academic medical centers, the top and in the top 10 and the 2 metrics are across 100 academic medical centers in the country. We do that because we can quickly translate the research and clinical trials to the bedside. And in the case of COVID, we literally were doing that very, very, very early. And that absolutely impacted those outcome measures that I mentioned and many, many more. So that's a real tangible example, Alberto, of how we translate quickly and leverage the power, as I call it, of the UCI Research University and Enterprise to power what we're doing at the bedside. So that's super, and that happens every day, by the way, not just around COVID, right? But that's just the most tangible example I can give you today. That's what I call knife's edge. We are on it. And we are very, very fortunate to have a partnership with the Children's Hospital of Orange County, or CHOC, in many ways, several different opportunities. And we are looking forward to their partnership as we grow at this new site as well. So we have a new chair of the Department of Pediatrics, the academic department of pediatrics, who also serves in a leadership role at CHOC. So a joint hire, and she's excellent, came from the East Coast as well to join us just recently. So we continue to work on opportunities where we can complement each other's strengths and meet the healthcare needs of this community.
We've got another question in the Q&A from Marcia Kendall. She's asking, are you incorporating functional medicine practitioners with this new facility?
Yes, not only at this new facility, but also we have opened a brand new site. Some of you are at that somewhat of a virtual ribbon cutting that we did a year ago in Newport, right off of MacArthur. Absolutely, yes. That is something that's also something that we're training the next generation of caregivers about as well.
Yeah, we did that ribbon cutting for you. We were happy to do it. And happy.
Thank you very much. And it seems like so long ago now, doesn't it?
So if you have a few more minutes, I have a bunch of questions here I still wanted to ask, at least a few of them. This is a pretty current one. It was popping up on my phone this morning. So the Supreme Court voted 7-2 this morning to, well, it was more on a procedural grounds, but to uphold the Affordable Care Act. And so do you have any thoughts on that? I mean, do you feel that the ACA has improved the health situation for Americans, or is it something that's burdensome for you because they kind of control the costs? And
no, I mean, as a person who spent his whole career in academic medical centers and health systems and public academic health systems, maybe I'm biased, but I think the Affordable Care Act was a very positive move. And I think it will continue to be challenged off and on, perhaps, who knows. But I'm still learning about the impacts of that in California. I've been here almost 3 years. And so it does impact states differently, as you may well know. Where I came from, University of North Carolina healthcare system in North Carolina, where they chose at that time not to expand the Medicaid program under the ACA, they had a different outcome because of that. And that's still a debate back east. So it does vary by state. But from my perspective, I think this is another positive step.
Great. So another question I had was, the medical care, especially hospital care sector here in Orange County has really heated up in the last several years, especially with the entrance of City Hope into the county and their plans to build a pretty significant hospital there in Irvine as well, cancer center. And it seems like, Hoag Hospital has also beefed up their cancer care. I know USC Keck Medicine, I think, is moving into a brand new building on Old Newport Boulevard here in Newport Beach. And now you're going to be building a cancer center as well. I mean, is it because there's an uptick in cancer, or is it, I imagine cancer treatment is very lucrative in the sense that, it's expensive treatment? Is that why the hospitals seem to be moving into that sector? Or is it just, hey, City of Hope's here, so we all need to up our game?
Yeah. So I'll give you my take on this. I think, first of all, Orange County is a great place to be. And a lot of people are moving here and it's growing, right? You all know this. There is still a lot of data that tells us that patients are leaving the county for care. The services that I mentioned that we're going to bring to this new site, what did you call it? Newport adjacent. I'm going to use
Newport
that.
adjacent, that's right.
Newport adjacent. The services we're bringing there is because the data tells us, it's not just Chad's crazy idea about what services to bring there. The data tells us over the last several years about the number of patients that are leaving the market area to get that care. And in many cases, jumping in an airplane at John Wayne and flying out of region to get that care. Well, we have the expertise to do that. So that's what we're bringing down to Newport adjacent and closer to your backyards. And to be quite honest, why are others doing it? Well, others are doing it because I think there's an opportunity for growth, right? To your point. And I love that. I am so happy that we have outstanding providers surrounding us because it gives patients choice, it improves their access, and the outcomes will be better. It has been proven. I've worked in very competitive marketplaces, much like I would say this one is from a healthcare perspective. Outcomes are better because of it. And we're not fighting each other. We're fighting the disease, the cancer, the COVID, whatever it could be. And so we will find all of our outcomes continue to improve. Like I mentioned, those metrics, top in California, top in the country. Those will continue to improve because of what's happening in this marketplace. So that's the way I see it. Hope that makes sense, but I think it's a real positive.
And that's just one of the specialties, right? At the
Correct.
Center for Advanced Care. There's multiple specialties that will be taking place there.
Correct. Absolutely. Yeah, that's one of several. And again, all the data supported those service lines that I mentioned, like orthopedics and spine, for a very specific spine niche. A lot of patients were leaving the market area for care, for example, and many, many more.
Well, as much as I want to wish you success in this new endeavor, I hope to never have to use the services of your facility, at least not for a very long time. So I think, well, we're almost 10 to the hour. So I think we probably need to move on to our other, the legislative representatives who've joined us this morning. But me personally, thank you for your time this morning. It was very interesting talk. I'm excited to see the new facility go up. It literally is a stone's throw from our office here. So we'll be, I can keep an eye on it for you if you need a
Thank you.
So you don't have to go all the way down from.
Thank you. I might ask you to give the next update once we're under construction.
Yeah, I could do that. Once a month, give an update, on the progress of the hospital. Happy to do it. And so, yeah, and anything you folks need from us, you guys are part of our leadership circle, which I appreciate as well. The support of the chamber and what we do here. And I wasn't kidding. I'm leaving an open invitation or an open offer, not an invitation, offer to help with that ribbon cutting for your Newport adjacent property, a new facility when you open it in 2023.
Thank you. Thanks for having me. Thanks so much for your leadership and for your colleagues that are on this call. If anything, the last 14 months have shown me as a healthcare provider is it takes a village, and we're better off because of that. So thank you so much. Please call on me or Alberto if I can do anything to help. Thank you.
Thank you, Chad.
Okay, Alberto. So it looks like if I look at my list here, we have Avery Counts with us on the call. Alexander Kim, I think, is on the call, and Matt Kern from Dave Min's office is also joined. I haven't seen anybody yet from Michelle Steele's office. So if you are here from Michelle Steele's office, please, put it in the chat that you're here so I can promote you. So I'm going to promote Avery first to a panelist, and he's going to give us an update on what's happening with the supervisor. So Avery, if you're listening, there he comes. Okay. Good morning, Avery.
Hello. Good morning, Steve.
Santa Ana.
What was that?
How are things in Santa Ana? Are you in Santa Ana? Is that your office or?
Right now I'm at home still. For their
Still at home?
meetings, I take them from home. So I'm in Huntington, a little closer.
Tell Katrina it's Liberation Day. You can come back to the office.
I showed her the video. She loved it.
Thank you.
So we're excited to be, being able to take our masks off more. Our whole office is vaccinated. So OSHA said we can take our masks off in the office. So we're really excited. The news for our office is we had our COVID memorial last Friday, June 11th. Really great time to make sure we remember the lives we lost as we move forward. Over 5,000 here in Orange County alone. Other than that, the supervisor is hard at work on the county budget, which goes to, I believe, the finalizing process on the 22nd during that board meeting. A lot of contracts, several $1 billion up. So it's taken a lot of work, but she's working hard. And then we've got our own job fair coming up as well. And we're just working hard, going to any event that we can, making sure we're in the community, working on casework, some in Newport Beach. I've got one in Huntington right now, one in Seal Beach. And we're here. If anybody wants to reach out to our office, my email is Avery, AVERY .counts, COUNTS @ocgov.com. We're happy to help. Anything you need, we're here for.
Great. Maybe you'll put that in the chat box and
Absolutely.
say hello to Katrina when you get to the office.
Will do.
And
Thank you, Steve.
She's doing a very good job. I'm pleased that she's out in the community and bringing the resources of the county, to the local cities and areas that she serves. So thank you.
Thank you.
All right, next up, why don't we go to Alexander Kim. Alexander, let me promote you to the panelists. Okay, there you go. And Alexander represents or works for Assemblywoman Cotty Petrie Norris. So Alexander, where are you? I'm going to give you 6 seconds to come on, and then if not, I'm going to go to Matt Kern. Oh, there he is. How you doing? Good morning.
Steve, I think I just pressed the wrong button.
That's okay. Story of my life.
I'll prove that I'm in the office here. So
There we
it
go.
is.
I knew somebody was in the office.
Yeah. So, yeah. As for the Assemblywoman's updates, just a couple of things on local news. We signed a support letter for the city of Newport Beach in terms of a support letter to Senator Padilla with regarding to funding for the Newport Harbor dredging. I know that the city every year, not every year, but once in a while asks for support. They, in part, it costs about $20 million a year to actually dredge the harbor because of the natural accumulation of silt that's built up from the upper areas of Orange County to.
Technically, it's not 20 million a year because we haven't done it.
Yeah, not 20 million a year. Yeah, that was going way over.
I don't want people to freak out and think, oh, we're spending $20 million a year.
Yeah. Usually it's 10 million from the federal government and 10 from local sources. So I know Mayor Avery is always looking for ways to seek support. So we're happy to do that from the state of California. I know there was concern about the algae growth also in the harbor, Calerpa, the algae. So I know the city is doing all that they can and asked our state to look for additional resources from various different departments, such as the wildlife department and going for that. So we're doing what we can there locally. As far as in general, we have the governor's May budget revised, $267 billion, with the $75 billion surplus. But what we're asking also, we're joining with other assembly members, particularly with Timothy Grayson and Tom Daly and 15 others, to ask the governor to have an increase in the budget reserves. As you know, the proposal was $24 billion just for having a rainy day fund. When I worked for Governor Schwarzenegger, it's one of the big things is all of us, it's important to have a savings account. There's a reason why we have that just in case for rainy days, and the government should be no different because the economic cycles goes up and down. Sometimes it's a long cycle, short cycle, but it's important to have a savings account that's big enough to offset the shocks, so that we don't have to have the state raid the local coffers to balance the budget. So that's something we're asking for. On the average, that's just like in 2001. A lot of the state surpluses comes from capital gains, as selling stocks and real estate. So it's, as the governor stated in the May revise, it's very unpredictable. So why not be prepared and ask for a bigger reserve? And a couple other bills to highlight that my boss has been supporting and authoring is one of them has to do with fraud unemployment funds. Have you heard in the news about the Employment Development Department, EDD, fraudsters? So AB 110 requires the department, the EDD, to cross-check incarceration records in order to prevent paying fraudulent benefits and wasting taxpayer dollars. So that was passed in the state assembly, waiting for the Senate to pass that. But this costs the taxpayers in tens of thousands. Over $810 million of taxpayer dollars were lost. And people are asking, why do we need this law? Isn't there something like this already? Well, the cross-checking of unemployment benefits against incarceration data is a common way to prevent fraud in other states. But in California, the law restricts the inmate information that can be shared with other state agencies. It's not allowed to. So what this bill does is basically enable the EDD to easily cross-check the information, including Social Security information. So it's a good way to catch criminals much faster, and working with the corrections and the Department of Corrections on that. In fact, go ahead, Steve.
So if you're a prisoner and you file for this unemployment insurance, do you have to like seek out work in the prison shop or something, or make license plates, or no?
Well, that's a question. That's a good question. Maybe I'll ask that. But
they have to like send in their form saying, "Oh yes, I inquired with the warden if there were any jobs available," or no?
Yeah, exactly. Well, the fact that they're asking that question, yeah, then we'll catch them right there. We want them to ask.
By definition, they're unemployed if they're in prison, right? I mean,
yeah, that's right.
Well, I'm making light of it actually, which is a very
no, of course, no. It's a surprising thing to a lot of people that we didn't have this cross-checking ability that other states have. So, and just one point related to that is that we asked the state assembly speaker to help us out because of the backlog. There's over 1 million cases statewide still pending. That's the majority of our calls is because of that backup. We asked the speaker to have at least a temporary worker in our office. So I've been interviewing all the past couple of weeks, just looking for a caseworker, only for 4 months. That's for every assembly office to deal with that. So hopefully we could reduce that backlog by the end of the year. So that's why we asked for 4 months. So we'll be having one for our office. Hopefully we'll hire that person about a week or a couple of weeks or so after orientation. So that's something that's good news. The other bill, just to highlight, and then I'll be done, is the AB 540, also authored by Assemblymember Peachy Norris. It's to increase access to safer and less costly nursing home alternatives. The state assembly voted unanimously for this, so bipartisan. It's to help seniors, especially low-income seniors, to access care in their communities while remaining independent in the homes. There was a survey done by Scan Healthcare, and that said that over 90% of seniors insist on being home while receiving care, and their families want that as well. So, and what this includes is called Program for All-Inclusive Care, or PACE, P-A-C-E. It provides medical and dental care, meal assistance, transportation services, family caregiver respite, physical therapy, socialization activities that enable seniors to age in the comfort of their own home, especially in Newport Beach, it's known as a retirement community in different areas. This is very important. This whole program PACE originated in California, so it's really time to get the word out about it. And given with the whole COVID-19 issues and things like that, it's important to allow seniors to know about this opportunity so they could age at home. So, and in fact, seniors that are enrolled in PACE, they live an average of with 20 medical conditions, a third of whom have Alzheimer's disease. So this is something that families request for. And all seniors that are enrolled in PACE are eligible for Medi-Cal. And 75% are also covered by Medicare. So that's very important to note. One last thing to note also is that the state assembly in its entirety has been asking each assembly office, including ours, to nominate a small business. So for California Small Business Day, that'll be recognized at the state capitol on August 18th. So it'll be much later. But the nominations, I sent the email blast to Steve, to you, and
We received
to UCI. Yeah. So we're receiving at least almost 100 nominations so far. So, but it's not too late. If you feel as a chamber member and the people on this call, if you want to nominate a small business, please go to our website. Because type in Cotty Peachy Norris or AD 74. We are in the 74th Assembly District, so AD 74, or just type in Cotty under Google and go on our website, and then you could have a very easy form to fill out to nominate either yourself or some other small business, and go from there. And we'll be making that announcement shortly later on next week. So
very good. Well, thank you.
Yeah.
Pretty
That's all I have.
comprehensive report.
Thank you.
Look forward to seeing you next month at our Government Affairs Committee, and certainly feel free to join us for anything we do here at the Newport Beach Chamber of Commerce. So
He's one of our favorite alums.
there you go.
Zot zot.
All right, let's jump over.
Thank you, Alberto.
Let's jump over to Matt Kern. I'm going to promote him to a panelist now, and Matt represents State Senator Dave Minn's office.
Hi, Steve. Hi, Alberto.
Hi,
I know we have to get to work, so I'll run through this a little quicker.
So you're at home too.
I get 2 days that I can be in the office right now under the Senate rules, and mine was Monday, Tuesday, but
I think we need to get you an Angels hat back there.
Yeah.
my daughter has one, but I grew up in St. Louis, so I got to represent the hometown team.
Uh-oh.
But yeah, so just a couple major items out of Sacramento. The 2021 budget passed the legislature, so we have a positive outlook about this, and I think we're in a pretty good place. 40% of the jobs in the United States this year were created in California, and the senator thinks that we have a bold, smart budget that's going to help Californians who are struggling because of the COVID-19 recession, while also making strategic, long-term investments in the state's future. Some highlights from the bill include $1.5 billion for small businesses and nonprofit grants. This is an expansion of the Small Business Relief Grant Program that came out of Senator Minn's bill, SB 87. In Newport Beach alone, over 500 businesses received grants under that program. We're expecting a new round of application to open up soon, so be on the lookout and reach out to our office if you need help with your application.
I actually got a call from them on an application that we put in on the first round and asking for some more information. So I'm thinking like, wow, maybe we might get one for the chamber. So that's kind of cool.
We've been, and I'll put my contact information in the chat too, but we've been helping a lot of businesses out with their applications. Definitely get to us early, and we can do more help.
Great.
But look for that. So we're expecting a new round to open up soon. Let's see. As far as Senator Minn's active bills, we're working on SB 607 with Senator Richard Roth. The bill is going to eliminate some unnecessary barriers for licensing in medical and dental occupations. So this bill passed the Senate. It's working its way through the Assembly. We're always on the lookout for any sort of like unnecessary red tape. This is a good example of that. If you've got a business and you're running into something, you don't understand why the state's doing that, reach out to us and we'll see if we can help. We're also working on SB 719. This bill helps facilitate the development of the Tustin Legacy Project. If you know where it is, that's the old Tustin Marine Corps Air Station site. That bill passed through the Senate and is currently in the Assembly. And finally, Senator Minn held a webinar with State Treasurer Fiona Ma about CalSavers. In May 25th, we did that. The webinar can be found on our social media, and that's for businesses and employees who are looking for information about the program. The deadline for businesses with more than 50 employees that don't offer traditional retirement plans is June 30th. So definitely check that out if you haven't done that already.
Yeah, I think that's going to be a big gotcha for a lot of businesses that are not even aware of this requirement now. It's not even a, just a program you can sign on to. If you're a business and you don't have some type of retirement plan in place for your employees, and you have to enroll in this CalSavers plan that will allow employees to invest in their wages voluntarily. They don't have to if they don't want to, but they can put money into the plan. It's just like a 401k plan. If they leave the employer, then they can take it with them to the next employer. But yeah, as you mentioned, if you have 50 or more employees, you should have already probably applied for that plan, because I think you're running out of time.
Yeah.
So what do they have till June 30th? Is that what you said?
June 30th is the
Yeah.
deadline for
And
that.
that's for 50 and over, and then for 5 and over, you have until next year, June 30th, to get in. So virtually almost every business in California, unless you have less than 5 employees, is going to need to either offer some type of retirement, 401k or something, or be enrolled in this CalSavers plan. And I understand there's some pretty significant penalties if you're not enrolled in the plan and offering it to your employees. So that's something for employers to mull over.
Yeah, one of their key points is the employers under the program, they're not a fiduciary. It's not too onerous to get set up to it, but definitely if you have questions, watch the seminar, reach out to us. We're in touch with CalSavers, and so we will help you out with that.
Great. Very good. Well, welcome to our group. I think you're new with the senator's office, right? Or
No, I've been with the senator since January, since he got in. But I've been doing some of the other chambers, and so I'm not getting to do Newport, so I'm happy about that.
Yeah, well,
This
tried
is
the
big time.
rest. Now you're with the best.
There we go.
All right. Well, we look forward to seeing you as well next month. Thank you, and certainly reach out to me if there's anything that I can help you or the senator with here in Newport Beach. So I think with that, we've basically exhausted our speakers for the day. I'll just remind the few members that are left on that tomorrow we're having our barbecue, our first barbecue on the patio. And masks are optional, certainly for vaccinated people. We look forward to seeing you. That'll be from 4:30 to 6 p.m. Here at the chamber offices. Wake Up Newport will be July 1st. It'll still be a virtual meeting, but I have received authorization from the library where we used to have Wake Up Newport, that we will be in person there in August, the first Thursday in August. So that's good news for that program. As far as Government Affairs Committee goes, I think Alberta and I will have to have a conversation to see, if we want to try and continue doing it on Zoom. I mean, we actually get a lot more people involved with the Zoom meeting than we used to in person. But if we do go back to in person, we'll just have to figure out a good place to have the meeting. So, and then the last thing is next week on Thursday, we're always on the fourth Thursday of the month, is our first in-person mixer again. So we're back for that. That'll be at Red O. Those are always a lot of fun and a great opportunity for people to meet and network with each other. Plus, you get to do it while you're sipping a margarita and chomping on some chips and salsa. So, or maybe even splurge and get some guacamole. So actually, they provide some appetizers for free, so it's a great deal for the members. So look forward to seeing you all at one thing or another in the next month or so. And Alberto, anything you want to conclude with?
Thank you for the opportunity, and have a wonderful day. Stay cool.
Thanks again to Chad. If you run into him, please tell him we really appreciated his talk today, and we look forward to seeing that new campus. Hospital campus spring up across the street here. All right.
All right. Have a good one.
And we'll see you next time. Thanks.